The touchdown that now has the country concerned over government's ability to tackle coronavirus should it come knocking, and its seriousness about Kenyan safety. The plane which flew into the country direct from Guangdong, China, had 239 passengers on board, 198 whom are of Chinese origin, 3 Kenyans and 30 others who are on transit. The government's move to allow them to go home, with the only advice being self-quarantine for 14 days, leaving Kenyans a worried lot.
You say that you isolate people, yet wanabeba mpaka akitoka airport anabeba na gari kama taxi na huyo dereva mwenye amembeba, si hata yeye atapata hiyo kitu na bado itaambukiza watu.
I'm not feeling safe. The government is not taking this thing seriously, because even the Chinese themselves, they have locked their city. So how comes in our country we allow a plane to land here, and then we are not even taking very serious measures? What we are saying is people should self-quarantine.
On social media, netizens also expressed their fears, castigating the government for the daring move. The government has in the recent past insisted that it has put adequate measures in place to handle a possibility of an outbreak. One of such measures being the takeover of a new ward with a capacity of 120 beds at the Mbagathi Hospital. And Thursday morning, a tour of the facility to ascertain this painted a different picture of a building still under renovation with no signs of any work in progress.
The government has also taken over a new ward with a bed capacity of 120 at Mbagathi District Hospital to further increase our isolation capacity.
And upon interrogation as why the 120-bed capacity facility only existed on paper, this is what the ministry, through the Chief Administrative Secretary Dr. Rashid Aman, had to say.
Mbagathi ward that the government has now taken hold of is indeed a building that was intended for other purposes, and as a national government we took it over because it serves our purpose of setting up an isolation facility there. So there is work to be done in terms of creating those spaces, creating the spaces for the divisions so that we can have the 120 and the capacity.
And as a measure to ensure the virus remains outside the country's borders, the ministry says it has enforced mandatory screening at all points of entry, with a total of 320,123 travellers having been screened across various points of entry since 20th of January. The ministry says the country now has the capacity to test for the virus locally, further saying that it has activated an emergency operations centre that monitors evaluation of the outbreak across the world, development of a contingency plan to guide implementation of the threat posed by importation of the virus, and establishment of isolation centres, including Kenyatta National Hospital, that has 11-bed capacity, among other measures. In terms of the African region preparedness, the World Health Organization has ranked Kenya among countries with adequate preparedness. The other countries include the neighboring Tanzania, Ethiopia, Algeria, Madagascar, among others. In terms of testing abilities, WHO says 18 countries in Africa, including Kenya, now have the ability to test for COVID-19. Even as the government maintains that it has put measures in place to deal with any eventuality, and that it has advised those who arrive from the epicenter to self-isolate for 14 days, the question that abounds is who is monitoring this self-isolation? Gloria Milimu, K24, Nairobi.